neighbors and friends, but somehow or other you spend this time with me here to gain some knowledge on what is shoulder and how we can maintain a good shoulder. So the topic today is shoulder pain. If you have in the morning you feel pain and how you get suddenly out of blue only you get a pain. Today we want to understand slightly deeper what is it. So in my program, you do feel this, right? Once in a while when you're working, yeah. Before I go further, I would like to go a little bit earlier. In Theravita, we basically focus on healthcare. Healthcare, I'm trying to differentiate between medical and health. Medical means you already get injury. Yeah, you already have a severe injury, rupture, you need some surgery to be done. Whereas in healthcare, we want to maintain health. So that's the reason why we want to care people who are around here to maintain your healthiness. And we have series. We do talk from foot pain, knee pain, back pain. Today we are talking about shoulder pain. So you are wondering why suddenly I choose shoulder pain, because it is a series. Yeah? Last talk we did talk on maintaining healthy joints. So that was a conclusion of all the joints. Are you ready? Shall we take off? Yeah. And today's talk, the content of today's talk is we're going to discuss a little bit about what is shoulder, what is the structures available in shoulder, and then bones, how many bones are there, how many joints, movement, what are the movements that is normal to be done by this joint, and what is rotator cuff, and what is glenoid labrum, and what are the common types and problems that shoulder pain has, and what is the solution now if you know the problems, and how do you treat it. Yeah? So this is how we're going to start. Are you ready? Are you okay? Are you okay? Yes. Okay. So first we talk about bones and cartilage. There are few bones that is responsible to make up a shoulder. So shoulder is not the point alone, but they are friends of few bones that mix up together. There are few muscles that I'm going to show you later, and tendons, and they have nerve supply. But today, unfortunately, I'm not going to touch so much on the nerve, because that will be covered in the neck pain. Yeah? And blood vessels. What are the blood vessels that pass through? And there is also a bursa. We want to know what is bursa. This is not bursa saham Kuala Lumpur. This is bursa shoulder pain. Okay. Let's go on the bones. There are three main bones that is available in shoulder. First bone known as clavicle, or we call it collarbone, here at the front here, which is the most softest bone. Actually, when you have a fall just by outreach like that and pressure fall on it, you might get rupture here. So be careful, don't let anybody touch your collarbone. They can be very painful, and it is normally supported by a strong pull muscle downward and two muscles upward. So it has a weak point in the center. So kind of risky, but when you have on your left side fracture, it disturbs your heart, because heart is just underneath there. The aorta vessels pass by just underneath there. So be very careful of your left side. Make sure it is healthy. Yeah. Second one is the scapula. Very important today, because a lot of people think shoulder pain means shoulder pain. And patient comes to me, they wonder, why am I not touching the shoulder, I'm touching somewhere else. Because I need to go and talk to scapula. Scapula is your shoulder blade, which is just behind your body. Yeah. We will see that also. And the actual bone that is responsible is your humerus, so which is your arm bone. Now, there are two joints mix up from these three bones. One is known as acroclavicular. Acromio means there is one ending part of scapula linked to your clavicle bone, which is your collarbone. Okay, there is one joint there. I'll show you that. Don't worry, no exams. And there is another one known as gleno. Gleno is also from your scapula and the humerus, which makes up the ball and socket joint. You will be surprised how God has designed this joint. It's a hanging joint. Yeah. I'll show you that. Now let's look. First we look at the three bones that I just told you. This is your front. Your chest will be here. So I've taken out your ribs. Without your ribs, left three bones there. One bone is the one I told you just now, collarbone is only a short one from here to here. Here it links to your mid chest. We call it sternum. So that the other part of it also same. So you have both sides balanced. Okay. So clavicle is just from this tip to this tip. Next, this is the acromion, which is actually part of your shoulder blade. There's one small sesungat or something that comes out from that shoulder blade. We call it acromion. So acromion, clavicle joint. There's one joint here. Second joint is when your humerus is a long shaft bone. Yeah? Long shaft bone with a half hemisphere here, which is covered by cartilage. A lot of people got arthritis of the joint because of cartilage damage. It's always related to your occupation. What do you work? What do you do? Yeah? How much do you repetitively hit? Are you okay so far? So this particular cartilage separates this particular glenoid. This scapula actually links to two bones. Now you know the most important bone for your shoulder is behind here. People thought it's front here, my pain is here. How come you're not touching here? My pain is here. It's here. Yeah. This is your scapula that really need to come back. Okay, you are aware now? Yeah. So this is one of the biggest joint. Second joint is a small fella here. That's all. Okay, there's only two joints in the shoulder. One is the glenoid. This cavity is known as glenoid. Humerus. Humerus is the bone name. Glenoid, humerus joint. Okay? Don't really have no exam. So if you know, good. If you do not know also, never mind. You only need to know there's two joints there. Okay? Let's go next. I want to show you a little bit on what more. If you see in X-ray, we see these three bones only. This is your ribs just now. So I didn't show the ribs just now. But you can see, this is the acromion. And then clavicle. You can see this person doesn't have good calcium here. The joint is not strong. Okay, there's an acromion, which is the acromion part of the bone, and clavicle, clavicular joint. The name is actually a combination of that two. Alright? And then the other one is this joint. We call it ball and socket joint. This is what we see in X-ray. So what do we see? We normally want to see, make sure that they are separated so that we know there is some synovial fluid that is actively playing its role to make sure that the fluid able to absorb your shock while you're working, so that you don't accumulate. If the two bones start grinding, you will feel pain. It's just like two rods grinding, you will feel pain. So the joint must be covered by cartilage, both ends, and with the synovial fluid. So from X-ray we can't see the cartilage, we can't see the synovial fluid, but we can predict by the distance. If you have distance, then your fluid is enough. Okay? So you know, synovial fluid comes from, is your blood joint. Yeah? Joint also have its own blood, but it is the crystal clear fluid that comes normally when you eat chicken. You open the joint, you will see the crystal clear. That is actually blood of the joint. But they behave in different standard. They are orang atas one. So they have to differently. But when you taste it, it is very sweet. It is very highly nutritious. Okay? It retains there the moment you use it. If you don't move it, it goes on naturally. It doesn't ask you anything. It's just like an owner of the house. The owner will give you notice if you don't pay your rental on time. He will give you notice by 1 month, please leave that house. So that's how the notice works. But this owner don't give you notice, he will just come out. If you want to do experiment, keep your one hand, put inside the book of that, don't move it. Why do I say book? Because book you can't open. So you stay like that, all the fluid will leave.